Alright. Good morning, or whatever time it may be for you. My name is Jack Bauer. There we go. And this is going to be my presentation on Clostridioditis difficile, commonly known as C. diff. Some overview. I'm going to introduce the bacterium, just give an overall overview of what it is, what gram stain it is, gram positive, gram negative, how it is transmitted, the diseases it causes and symptoms, what lab testing is done to detect if it is C. diff or not, treatments, and new data. So, what is Clostridioditis difficile? Clostridioditis difficile is commonly known as C. diff, and I'll probably just refer to it as C. diff because that is a long word. It is gram-positive, meaning that its peptidoglycan layer is thicker in its cell wall, and this causes the gram staining to stay purple throughout the entire process of gram staining. When you put the acetone on, it doesn't get rid of all of it. We know about this. It's spore-forming, meaning that as a defense mechanism, if it's in an environment that isn't as ideal, it can produce spores, and this allows it to stay dormant for long periods of time, and it allows for it to live in areas with no oxygen and whatnot. It's also anaerobic, which means it can thrive in environments with no oxygen, and oxygen can actually harm the growth of it. It's mainly transmitted through the fecal-oral route. That doesn't mean you're going around eating someone's poop. It mainly means contaminated surfaces. So if you have a patient with C. diff and the proper sanitation isn't being taken place, and you get it on your hands, you get it through your mouth. It's not commonly transmitted through airborne, but it can occur, though it's very rare that it would. It's mainly when you get it on your hands, or you just get it on some part of your body and it enters your mouth. Another common route is through antibiotics. This is mainly seen in a healthcare setting, when healthcare is where it's commonly seen, C. diff. And this is when you take antibiotics for, let's say you have an infection, you got a cut on your leg, it gets infected, you need to take antibiotics. And then when you're taking the antibiotics, it wipes out the good and bad bacteria in your gut. And that is because antibiotics aren't able to differentiate between the two. So when the good bacteria gets wiped out, it prevents it from allowing C. diff to overgrow. C. diff overgrows. What diseases does it cause and symptoms? It causes Clostridioditis difficile infection, or just C. diff infection. It causes very watery diarrhea, sometimes bloody. It causes a very foul smell. I had a patient with C. diff, and it is one of the worst smells you will ever experience in your life, and it almost smells sweet in a way. It causes abdominal pain, and it also causes nausea and vomiting. Among other things, it can also cause decreased appetite. Ways to test for C. diff. You can test through stool sample analysis tests, and that goes these two right here, a PCR test, and then an enzyme immunoassay test. A PCR test is mainly when it's used to detect the certain genes that code the C. diff toxins, and it is a very highly sensitive test, meaning that rapid results, you will get results rapidly. Same thing with the immunoassay test. It detects certain toxins produced by C. diff, so toxin A, toxin B, and then I think it's glutamate dehydrogenase. Sorry. This test is less sensitive than the PCR test, so the results aren't as rapid, but they kind of do the same thing. And then, how is C. diff treated? It is treated mainly through antibiotics, and this is an antibiotic known as vancomycin. Vancomycin is mainly taken intravenously, so that means through the bloodstream, just immediately you get a catheter in your arm and it goes. But vancomycin is taken intravenously mainly due to it's staying in the gut and not metabolizing into the blood when taken orally, but that actually works in favor for C. diff because take it orally, stays in your gut, that's where C. diff is, and treats it. If the C. diff case is so severe that antibiotics aren't really working, or something like toxic megacolon occurring, and toxic megacolon is where a segment of your large intestine becomes so inflamed and just dilated that perforation can occur, and perforation is just when a hole or just an opening happens somewhere in that segment. And if that is occurring, what can be done is a stool sample with healthy bacteria in it. It's tested to see if the healthy bacteria are present, and then you get surgery done where you opened up, large intestine opened up, you put the healthy feces into the affected area, and then it introduces a good bacteria back in to prevent more overgrowth and even like getting rid of the C. diff. And then new data surrounding C. diff, so there actually has been a decrease in cases in healthcare settings related to C. diff, and this is mainly due to the CDC implementing new things to just lower it. So better PPE. When I had the patient with C. diff, what was required is that you need to wear a gown. It prevents stuff from getting onto your skin. You wear 2 sets of gloves. The top layer is the dirty layer, and then the bottom layer is just to be sure that nothing gets into the gown. And then you normally would want to wear a hood, but depending on the how well off your working is, they can't always afford the hood, so you wear just a face shield. If you wear the face shield, you need to wear eye protection, and then you also need to wear an N95 mask. N95 mask prevents stuff from coming into the mask in comparison to a normal mask that prevents stuff from going out. And then better hand washing techniques. So if you work in a healthcare setting, you've probably seen signs everywhere telling you, I think it's 20 seconds, water your hands, and then put soap on, scrub for I think it's 15 seconds, and that's mainly due to you want like the heat and friction of the soap just to get all the bacteria off, and then you wash your hands again, and then you dry, and then using the paper towel you turn off the sink. And these are my sources.